Is your teen suddenly developing breast tissue and you're not sure if it's normal or something serious? Can boys really grow breasts during puberty, and what should you do if it happens? Does your teen feel embarrassed to take off his shirt because of puffy nipples or chest changes? And is weight gain the only reason for a larger chest in boys, or could it be something hormonal? How can you tell the difference between normal puberty changes and a hormonal imbalance in a teenage boy? This is what I will try to answer for you today. So let's start with question number one. Is your teen suddenly developing breast tissue and you don't know if this is normal or something serious? More than 50% of teenager boys, when they go into puberty, they can have a little bit of breast tissue. So oftentimes this can be physiologic, although there are some conditions that this can be due to an underlying endocrine problem and due to some endocrine conditions. Now, the best way to obviously know if this is a medical condition, this is physiologic, is to visit your pediatrician. They can take a full medical history. They can examine the teenager and can tell you if more testing is needed and if the teenager needs to be seen by a pediatric endocrinologist. Question number two, can boys really grow breast buds during puberty, and what should you do if it happens? Yes, it does happen, as I mentioned, in more than 50%. And the best thing to do about it is to visit your doctor and discuss about it. Now, there are some red flags or reassuring factors when we evaluate the breast on a teenager. So if there is breast only on one side versus if it is on both sides, that may require more evaluation. If there is breast development when there is no sign of puberty, that may require an evaluation. If there is breast development when there is nipple discharge, redness, or irritation, that may require more evaluation. That is why it is important to talk to your pediatrician if you are concerned whether a teenage boy has normal breast or something that may require more evaluation. Does your teen feel embarrassed to take off his shirts because of puffy nipples? If that is the case, let me tell you that this is very common. I see a lot of teenagers that have this issue and they tell me this again and again. It can be summertime, they feel uncomfortable to go to the swimming pool, they feel uncomfortable to exercise wearing tight shirts. Because of that, they will choose the type of clothes that they wear because they feel uncomfortable. Now, if this is your teenager, that may imply that this particular teenage boy may have some anxiety, which can be real. It can lead to depression. It can also lead to overeating. So it does require some evaluation and treatment. In rare cases, there are medications, there are even surgeries when the severity of these effects of the breast in boys become very severe. So I highly recommend that you talk to your pediatrician about it. Number four, is weight gain the only reason for larger chest in boys, or could be something hormonal? There is a difference whether the breast in a boy is due to hormones or whether the breast is due to fat development. The difference is if it is due to extra weight gain, the consistency of the breast is more soft and it feels more like fat, and this is why we call this lipomastia, lipo from Greek word lipos, which means fat. So if there is breast that has a lot of fat, we call it lipomastia. That is because of extra weight gain. If it is breast because of hormone imbalances, meaning there is more estrogen than testosterone, then we call that gynecomastia. One teenager can have both lipomastia and gynecomastia, and it can be difficult to differentiate between the two. That's why a pediatric endocrinologist can do a physical exam and can do more testing and see whether it is the one or the other. However, I want to say that once again, it is very common to have both. It is very common to have lipomastia. It is very common to have gynecomastia in boys that are in puberty. It can also be a combination of the two. In the majority of cases, even if it is due to hormonal imbalances, meaning it's due to having more estrogen than testosterone, that can still be physiologic in puberty, although there are cases that it is caused by pathologic conditions. What happens in boys when they gain extra weight? When they have more fat that goes and sits around their breast, there is what we call aromatization of the testosterone. Aromatization is a process where the testosterone becomes estradiol because in the fat tissue there is an enzyme that makes this conversion. This enzyme exists in all boys, in all males, in small quantities. But when you have more fat in your body, there is more of that enzyme. And because there is more fat on the breast tissue, you have more conversion of androgens to estrogens, and therefore you can have some of the lipomastia turn into true gynecomastia because there is more fat around the nipples area. So I'm saying that to say that those two conditions are connected, and it can be just variation of the normal. However, there can be due to other hormonal imbalances, and a pediatric endocrinologist can run those tests because they can be tumors, they can be more serious conditions associated with that. So talk to your doctor if that is the case. How can you tell the difference if this is normal puberty versus a hormonal imbalance? I mentioned some of the red flags earlier, meaning if there is discharge, if there is pain, if it's only one breast, if there is a significant increase of the breast, if the teenager is growing more than they should, if there is lack of puberty progression, if there is lack of seeing other signs of puberty and androgens in the boy. Obviously, this requires more thorough evaluation. I recommend you talk to your doctor if you have any concerns. Finally, I want to say what is the best approach to a boy that has extra weight and feels concerned about the breast development. If the workup has been done and there is no other pathologic condition, and this is mainly attributed to extra weight, is weight loss gonna reverse the breast once they lose the weight? And the answer is it depends. As I mentioned earlier, if there is true gynecomastia on a boy that has excess fat for a prolonged period of time, if the breast development stays there for, let's say, 5 years, then there can be fibrous tissue that sits on the breast and it may not completely disappear, even if the teenager gets to a healthy weight. However, if this has been for less period of time, then it can completely reverse. Now, what can also help is strength training exercise of the upper chest that can help build more muscles in the area. And the combination of the two, doing strength training exercise of the chest along with getting into a healthier weight, in the majority of cases is enough to resolve that problem. Sometimes some teenagers are still not happy with the result and they end up having plastic surgery as the last. And again, if that is the case, your doctor would be the best to advise you about that. However, the first step should always be, in my opinion, to try lifestyle modifications in a way that builds healthy habits so that teenagers get into a healthier weight and then see the fat decreases from other parts of the body. It also decreases from the area around the breast and the chest gets better, the confidence gets better, they don't have to hide, and they feel much better with their body. Given that teenager boys are very sensitive as teenager girls in their appearance, we should always try to approach this topic in a very sensitive way because it's not their fault. A lot of this happens physiologically in puberty, and they do have some control over to as to what they're eating and whether they can do exercise or not. But some of them, they don't have control. There is normally some testosterone that will become estrogen that will produce some breast tissue, and that's like part of normal puberty and will just go away as the testosterone gets higher and higher as the puberty increases. So I hope that was helpful. Reach out to me if you want me to talk about any specific questions, and sign up to my newsletter, lifestyleforteens.com/newsletter, to get my weekly email with more tips on how to help teenagers get to a healthier weight.